Hello, everybody, and welcome to Aesthetify India's latest podcast episode. I'm Gunjan, co founder Aesthetify India. So, in today's episode, we'll explore how to navigate into your journey of aesthetics. Entering into aesthetics practice is just not about learning the right techniques. Rather, it's a complete shift in your approach and the mindset in how are you treating your patients. And it all begins with the right foundation. So you will want to know about the right courses which will not only teach you about the injection skills but also will guide you through the right anatomy and the artistry what you really need in this field. And let's not undermine the importance of the right mentor. A mentor who brings in years of experience, a passion for teaching, and also gives lot of importance to the patient's safety. So, in today's episode, we will see and we will explore how to accelerate this journey. And I'm thrilled to have Dr. Indu Ballani ma'am with us. And ma'am is a renowned dermatologist and an expert trainer in the field of aesthetics. So, ma'am, without any further ado, I would like to welcome you on behalf of Aesthetify India and thank you so much for taking out time for us.
Thanks a lot, Gunjan.
So
So,
we'll start with your journey, ma'am, because I think let's set the precedence for our audience over here.
mhm,
That how did you make this shift? Because usually what happens once you're done with your medical
mhm,
degrees, once
mhm,
you've done your MD
mhm,
dermatology,
mhm.
the usual path is to start with clinical dermatology. So what made this shift for you?
So at my time, yes, it was more mainly clinical dermatology. Now there are dermatologists who are passing out and going straight into aesthetic dermatology only. But when I started and I shifted to Delhi from a small town, so I basically was not getting any government type of SR shape or something in medical colleges or anything. So I just by luck entered into a cosmetic clinic, joined a clinic where I was appointed as a dermatologist, but then I saw how they were mainly just concentrating on the aesthetics part and all. But then, as a dermatologist, because of my knowledge which I had gained with dermatology, because of the knowledge of the skin, the in-depth knowledge which I knew, I learned how to apply it in cosmetic concerns and how to give patients better results. So actually, we all during our course of dermatology we learn how to prescribe medicines and how to give them something to lighten the pigmentation or something. But now the world is changing. There are many like the just the tubes, if we prescribe, many patients are not happy with those products that they use. They want something aesthetic, some cosmetic serums or something. So gradually I learned how to apply this knowledge into cosmetic, and then I started loving the results, and the it turned into a blend of science and art gradually.
Yes, absolutely. I think that was your starting point.
Yeah.
So now I will also highlight and would need your inputs over here how the journey began for you in terms of learning. So this was your experience learning
Yeah.
on the job training.
Mhm.
But what were the foundational courses?
Mm.
And along with that, something very unique or some
Mhm.
advanced courses which really
Mm.
led you to your advanced role as a mentor in the aesthetics
Yeah.
field.
So the first time I injected Botox, it was just by reading in a book. So that was it. And but by patient, thankfully there was no complication or anything. Then I tried to inject a filler also on my own, but then the results were not that great, because obviously you don't get that knowledge just by reading. You have to have a mentor. You have to have somebody to guide you how much product, where to inject, and all that. So gradually then these companies which came in introduced fillers at that time. So it was earlier, just the fillers had just started coming in. So they had some training programs. So I learned from some like my own mentor, my in injectables, and then I started doing and getting results. And one thing is, I think like with practice, it goes on improving. So I did have a lot of complications earlier, But then as I got better, like learned the importance of uh, trainings and everything, because I also started attending more courses, more trainings held by companies, or some certificate courses, some 2 3 day courses also, or some international conferences and all. I started going everywhere, and every time I found out that whatever I attended, it was like at least one new thing I learned. Maybe it was the same topic, but I did learn something new from somebody different. So you need to know all the perspectives also. So like that, then when I came into training, I started my first course. So uh, I also felt the need that there should be something, some structured course for people passing out, so that they don't have to go all that hard way and have years of learning involved in all this.
Absolutely, you've touched on a
Hmm.
very important point, and this is the whole, agenda of today's discussion:
Hmm.
how to accelerate it. Structure is important, but
Yeah.
at the same time, it should also give an acceleration.
Yeah.
So now we will talk and we will map the journey.
Hmm.
So if there is a new injector, or let's
Mhm.
say there is a new practitioner,
Hmm.
so let's talk about step one over here. So what would be the initial course, as per, like, now there are a lot many things available, so how should an initial journey look like?
So like now, see, nowadays there's a lot of quackery also going on, but like if you are a dermatologist, if you've had some structured, like you've had your MD degree or your diploma for that matter, you have some knowledge of the skin aspects and everything. You do know the anatomy of the skin as well. But then for injectables, you have to go back to your basic, like your first year MBBS anatomy of the head and neck region, because you are dealing with the face. So that is something different, some different anatomy which you have to learn after like completing your PG. And then so you can, for the applications and for the other superficial procedures, it's okay that that knowledge also can apply, whatever you've learned during your PG years, post graduation years. But then after that, you have to separately learn your deeper anatomy of the face and practice. So practice also, by attending just one workshop here, one workshop there, won't be sufficient. So that is why I have these structured courses also, where you inject a full syringe, so that you can have a full hands on experience or a full face how to deal with it. Because you'll be taught maybe nasolabial folds or lips in some, but if that is looking aesthetically good on the patient, if the patient needs the lips or not, that is also important. So so your science learning is complete, but then how to blend it with the art, you really have to have something after passing out, some sort of course you need.
Right, and more experience in this field will
Will,
enhance
yeah,
your
of course, the more
artistry.
you practice, the more you inject. That is why I tell fresh dermatologists, if they're starting with the practice also, once they are into practice, they have these clinical patients coming to them, they do their peels and other, treat their acne, pigmentation and everything. Gradually, when these patients start getting good results and their relatives are also coming, so they will ask you for those injectables and all. So when they start asking you, you start doing these courses. Maybe like the theory part first you can do online also, and then go and learn somewhere, inject and apply it immediately the next week on your patients. Then only you will get into that practice, and you will get better results, and you will get better at what you're doing.
So find opportunities wherever they're available.
Yes, yes, sure.
Okay. And you've already talked about hands-on workshops, but do you think that there is a structure in that also available for people to learn?
Yeah, you obviously you have to start with the basic first. So basic is I think the basic PRPs and the skin boosters and everything, dermatologists who have done their PG would already be comfortable with. But still doing it on the face, how to avoid bruises, and there are certain techniques involved, where to inject and how to inject is important even with those. And once they are well versed with the upper layer of the skin, giving a resurfacing, and training in lasers and everything also, then they can go on to the other fillers and the threadless and everything. And the next step would be like full face contouring.
Okay. Okay. And there are a lot of conferences happening now.
Mhm.
There are workshops, but there are a lot of other conferences. There are
Mhm.
national conferences, there are state level conferences, then there are international conferences. So how do these contribute to your learning? Because sometimes you feel overwhelmed with so much information,
Yeah,
and
yeah,
there is too much exposure for you.
yeah.
So, and plus there is a time management which is needed as a practitioner. So
Mm.
what to choose, how to choose? So is can you define? I mean, the template will be different for everybody, but
Yeah.
a certain structure would always be helpful.
See, one national conference per year is essential.
Mm-hmm.
That can be, if you want to blend between your dermatology practice and cosmetic
Okay.
practice aesthetic,
Mm.
then it should be like one dermatology main. We have this dermacon every year.
Mm.
You should be attending, because then you come to know what is new, how others are managing. There's some different modalities of treatment also which are coming up. Some newer drugs also, you come to know about them.
Mm.
Then there are some pure aesthetic conferences also, where you learn about the injectables and what's new in injectables also. So every year there's so much happening, so many new things are being introduced. So at least you should have a knowledge about them. So if you are already injecting, supposing skin boosters, but something like PDRN has come up now, or exosomes are coming up, the injection method is the same. So if you know about them, you can also inculcate it into your practice. And so one aesthetic, one dermatology, and if you can, one international exposure is also important, because then again, internationally, what is happening, what is new, you get to know about all that.
Right. So, yeah, three minimum is what
Yeah.
is needed. Okay. Now, let's talk about assessment also, because choosing the right course, choosing the right mentor, choosing the right conference is important.
Yeah.
So, what should be the assessment criteria? Because we are seeing a flood of training happening, we are seeing so many mentors entering into this,
Mm.
and all sorts now. So,
Mm.
what should be the criteria of assessment for a person entering into aesthetics?
Mhm. So wherever there is, first of all, hands-on,
Mm-hmm.
you should prefer those
Okay.
workshops and all.
Mm.
And also the number of delegates in a workshop, or if you're doing a separate course, then that's different, then
Mm.
you'll get a good proper hands-on.
Mm.
But if not, if you're just attending a workshop, then also the number of delegates and how much product, you should actually make it clear how much product you'll be getting to inject, what areas you will be dealing with in that workshop.
Mm-hmm.
And of course, by word of mouth also, people come to know where they can gain more knowledge, or
Mm-hmm.
like who teaches in a good way, so that
Mm.
you really grasp these intricacies of
Mm.
injections and
Mm-hmm.
everything.
Okay. So, like networking will also help.
Networking, of course, is very, very
Will
important. Yeah.
also help you. Aesthetics is an umbrella. There are a lot many other specialization also which comes under this umbrella. So finding your niche is important, and also what should be the right beginning point.
Okay. So as I said, right beginning point is start from clinical.
Okay.
So once your patients are coming in, they'll come to you mostly in private practice. We get patients of acne,
Hmm.
pigmentation.
Hmm.
So you can add your aesthetic procedures to give them better results, like simple chemical peels. Also, if you add an acne, they'll work in a better way. They will remove the marks in a better way. For pigmentation, also, if you're introducing your peels, your lasers, PRPs, or even these skin boosters, exosomes, they're working wonderfully on pigmentation. So that ways you can start with these, and when you start getting these clinical results, and these, you see that these patients are grateful for these, for the results that they're giving, that you're giving them, and in a better way than what you were doing in your PG when you're just prescribing those creams. They are getting better results. Then the interest, our interest also becomes like, we delve deeper into it and we try to give them more.
Hmm.
So that is how it can gradually, over a period of years,
Okay.
develop into more of aesthetic practice, or blending. Basically, it's a blending of clinical and aesthetic dermatology, which is the best, because you need to always, since you are a scientific person, you have a degree, you cannot work like wax and just go on injecting or just go on doing these aesthetic procedures. There has to be a reason, and the results have to be better than what is given by a general like esthetician in the market.
Right. And along with safety,
Yeah,
definitely.
of course.
Now, my next question to you is, we are talking about clinical dermatology here. How to find that right balance between clinical dermatology and aesthetics practice? Because sometimes it gets tricky, and as a dermatologist, you will always have a bent of clinical side.
Yeah, yeah.
So, how to find that right balance?
It is more rewarding if you blend your clinical dermatology with your aesthetic dermatology. Just pure aesthetics is never that satisfying. Somewhere inside there is a physician, a clinical physician within
A
you who
doctor.
wants to, yeah, who wants to practice also. So it's always a blend, and you should never forget your clinical dermatology. You should always have a separate time for your clinical patients also.
Right. Also, I would want to touch upon complications, because with injectables, with aesthetics, there are a lot of complications, and especially when you're starting, then it is bound to happen.
Yeah.
So, how to manage that, and how to create that ecosystem for yourself, which can benefit your patient in the maximum way.
So when you have learned something, when you have uh, followed a proper structure and learned it from somebody, then maybe you will be taught the complications also which can happen and how to deal with them. And if you are actually, like I said, you are already, you have that knowledge. So if you really apply your scientific knowledge and do everything in a structured way, then even complications can be minimized. Some, of course, bruising and everything is sometimes unavoidable. So that is what, like, there is a difference between a pure clinical dermatologist and somebody who's practicing aesthetics also, because you have to do a lot of hand holding, you have to counsel a lot, you have to speak a lot. So your way of speaking, it's not just like in the government. When we were studying, we used to just look at the patients, write the prescription and shove them away. That is not, that cannot be done in private practice anywhere. But again, in aesthetics, you need to be extra careful. You need to spend more time in counseling and talking to the patient. And if any complication comes up also, if you're doing it in a proper, like if you're hand holding, if you are concerned about the patient, if you're empathetic, then that goes a long way in, like, the patient also, you retaining that patient or the client, which we call them, some pure aesthetic ones, and increasing their confidence in you.
Right, very rightly said. In fact, I wanted to cover this topic also in what is the difference between the setup of a clinical dermatologist and an aesthetic dermatologist. And if you're making that shift, then how your practice should change. I think you've rightly said, the patient becomes the client,
Client.
and time spent is more,
More, yeah, yeah.
definitely. Okay. And also, ma'am, do you see any changes happening in the training techniques or in the ways in which the training is being done currently?
Yeah. So artificial intelligence is coming up now, and there are a lot of simulation models. So even anatomy nowadays, many medical colleges are coming up with these models where you can study the anatomy, just like you have these 3D models, and you can peel off the layers and see everything. So I think anatomy models are soon the future. They will be learning anatomy and maybe injecting on models first and then injecting into live patients.
Right. Okay, thank you so much, ma'am. I think this has been such a thoughtful and inspiring session for all of us here. And I feel that audience have taken a lot of takeaways if they are starting or they're making a shift from clinical dermatology to aesthetics practice. So if you have liked today's episode, please like, subscribe, and share our channel. And also keep innovating in your practices. Thank you so much.
Thank you.